Welcome, everyone. Today's session is honoring Mental Health Awareness Month in the month of May. We're really happy to have two speakers from the Qazizada Multicultural Institute. We have Brother Wali Abdul Hanifzai and Maimoona Naveed. A little bit about Brother Wali here. He received his bachelor's degree from California State University, Northridge in criminology and a master's degree in social work from the University of Southern California, and he is currently a PhD candidate in the Global Leadership and Change Program at Pepperdine University. He's the executive director of Qazizada Multicultural Therapy Clinic, a nonprofit that provides mental health services and educational workshops predominantly to the Samina and Afghan refugee communities. And he is joined here today with his trainee, Maimoona Naveed, and he will introduce her as well during his presentation. We will open the chat for any questions that might come to you during the presentation, but the question and answer session will be more towards the end. So hold that thought. If you have something to ask, write it down somewhere, or you can put it in the chat box and it will be addressed towards the end. Without further ado, welcome, Brother Wali.
Sorry about that. I thought I had it. I had my mic on. Bismillah, salatu wa salam, ya Rasulullah. Assalamu alaikum, everyone. I hope that you're all doing well. Good morning to everyone. Very pleased to be back here at Olive, speaking with my Olivers. It has been a while. It's always a blessing to be able to share the same space with everyone here. One thing that I've learned is that this group of special individuals that you guys are, every time that I've come and every time that I've been able to partake in a program, I've always learned something going back. So I'm highly excited to always be here with you all. That being said, thank you, Sister Zainab, for your wonderful work and for having us come in and do a programming today. So my name is Wali Hanifzai, and today I will be facilitating a program where we're going to be discussing and talking about the importance of managing depression and anxiety with my colleague Maimoona Naveed. She is a marriage, family, and therapy trainee who is coming to us from the school of USC as well. She did her undergrad at UCR, and she comes with a great background of knowledge that she has in the field of psychology and marriage and family therapy. And yeah, and when we're here to share some information, and I hope it's something that can be beneficial to you and your family and people in the community. The next slide, please. Maimoona, before we start, did you wanted to do a quick intro as well?
No, I think you covered everything. I'm Maimoona. I'm a trainee at Qazizada Clinic, and I also go to USC where I'm doing my master's. So yeah, I'm excited to be joining everyone today.
Awesome. So today's overview, so we have a layout for you all. We're going to go ahead and discuss 8 points. So the way the overview looks, we're going to talk about, number one, the signs and symptoms of what anxiety and depression looks like. Second, we're going to talk about the risk factors. Third, we're going to cover protective factors. Fourth is the case scenarios. There's a case vignette, where we would love to have our participants, partake in that activity with us, because it would be much more fruitful. Fifth is coping and management. Sixth is grounding techniques. 7 will cover over further care and what that looks like in terms of management. And then 8, how can you support loved ones who are going through anxiety and depression as well? Next slide, please.
So some of the signs and symptoms of anxiety, we've decided to divide it into 4 categories. The first one being physiological. So physiological symptoms are the disruption of normal bodily functions and processing. So these are more biochemical and physical functionings. And then these could be increased heart rate, sweating, dizziness, nausea. And then we have psychological symptoms, which are more symptoms that are experienced mentally. So this could be continuous worry, fear, numbness, tension. And then we have our somatic symptoms, which are the body's physical symptoms or complaints. And all these symptoms are very interrelated. So one symptom might start to affect another symptom. So you will see that there is a little bit of overlap between the categories. So somatic symptoms being the physical complaints and symptoms. So these are headaches, fatigue, backaches, chest pain, any sort of pain in the body. And then we have our chronic symptoms, which are long-term symptoms. So a lot of these symptoms can last for a longer duration of time if not addressed or treated. So this includes irritability, restlessness, difficulty concentrating, and agitation.
Second, we're going to go ahead and take a look at the signs and symptoms of depression. Just similarly in the same format, we're going to look at the physiological symptoms. While with somebody has depression, you'll notice that individuals feeling or experiencing pain, digestive problems, sleep disturbances, where when they're sleeping, they're constantly waking up during the middle of the night, or they have too much going on in their mind, and there's usually changes in appetite. And then the psychological symptoms are anhedonia, which is lack of pleasure, loneliness. People and individuals start to feel very lonely, no matter, even if they're in a social gathering, there's this sense of just not wanting to be around other people. And that's usually pretty common. And then we have ablation, which is defined as a lack of motivation or ability to do tasks, basically, or activities that have an end goal, and makes it very difficult for them to have that motivation to get up and get a task completed, because a person feels very down, right? And they can't really get up and they can do a specific chore, or if somebody wants to go take out a trash, it's like you're not going to get up and you're not going to do it because you don't have the motivation. There's symptoms of sadness. This is very common in depression, hopelessness, exhaustion, and then also we see a lot of crying spells at times. And now getting to somatic symptoms, during those times, we notice that there's signs of fatigue, weakness, low mood, and anxiety. And then lastly, we come to chronic symptoms. These are changes in weight. You start to realize that there's a weight fluctuation where a person either just like earlier today, Sister Zainab stated, right, how food is usually affected as well. And that's because when somebody feels depressed, one of the symptoms is that either you have no appetite and it affects, because your nervous system is affected, where you start losing weight, or in order to cope with a specific scenario, or in order to feel good, right, in order to get those dopamine back in and get that sugar rush, or in order to feel better, you start to eat. It's either a form of a coping mechanism, right? And that also isn't good, because you're not looking, or you're not being mindful of what are you putting into your body. And then there's insomnia, and then the other symptom is chronic sadness and worthlessness. And now I also wanted to indicate that individuals usually, these are the symptoms of depression. Also, as we go further, I'll talk about how a person is also in our field. We consider them being clinically, having clinical depression. When there's a diagnosis that comes into place. So all these symptoms that you look at, usually you need about 5 or more symptoms take course simultaneously at the same time, where if somebody is experiencing change in appetite, fatigue, having crying spells, having feeling loneliness. If you're having 5 or more symptoms for more than 2 weeks and it stays that way, then we recommend that you seek some professional help. Next slide, please.
So next, we're going to go over risk factors that might make a person more prone to anxiety and depression symptoms. So the first one is major life events. So this could be the death of a loved one, a change in your living situation, losing your job, anything that kind of changes the regular course of a person's life. Then we have family history. So a lot of these disorders are genetic. So if you have a family history of depression or anxiety, you can be genetically predisposed to developing symptoms of anxiety and depression. Then we have medical conditions. So this could be a disease that a person might be battling, or a sickness, any sort of illness that might have a toll on their mental health. And this kind of goes hand in hand with the natural aging process. As our bodies start to slow down, we might see that we're not functioning as we usually do, and we're doing things a lot slower, and our bodies aren't the same as they were, as they once were. That can kind of also take a toll on our mental health and lead to symptoms of anxiety and depression. And then we have isolation. So when we spend time alone and we're not around our community, our friends, or our families, we start to kind of overthink and be in sadness a lot. And so social connection is very important. And we'll go over that a little bit later too. And so we're also going to talk about at-risk populations. So populations that are more at risk of developing anxiety and depression. These include older adults, so 60 to 70 and up, adolescents, so ages 13 to young 20s, and then people that have lived through war, poverty, or a pandemic. So a lot of us actually have lived through the pandemic, like COVID, refugees or immigrants, and then those who have gone through a traumatic event, or physical and sexual abuse survivors.
Next, we're going to take a look at the protective factors now. Protective factors serve as an additional layer of support when battling anxiety and depression. It's important to look and see, what does your social support look like? And this is very important for any human interaction, to see, what does your environment look like? What does that really look like, right? Starting from your household, right? When it comes to your partner, when it comes to your kids, your grandkids, the community or the organizations you're a part of, how does that look like? Because that's also going to determine how your mood is going to be, and if you're going to be at risk of, falling into any sorts of, having any sorts of symptoms of depression or anxiety, but at the same time also fall into depression in the long term. Because one thing we have to understand is that, amongst our seniors and elders, they're at a high risk of falling into depression because of loneliness, and because of social isolation first. So social isolation causing loneliness. So it's very important knowing that for every individual, always, being able to secure yourself and always put yourself in environments where you are, noticing that, I'm in an environment where there's positive talk. I'm in an environment where I am going in and I'm laughing and I'm smiling and I'm happy, right? I'm genuinely happy. I'm not around individuals who are constantly, talking down upon others, constantly, feeling down. Maybe they're going through life challenges and struggles, which is okay. Families and friends should express those to you, which is important because they have a deep connection with you. But when it comes time where you start providing that additional support, or you're lending that ear, we say, right? You're giving them that space, and you're supporting them, and you're kind of directing them to seeking, professional support, and they don't do it, then guess what happens? It starts to affect you, right, in the long term, because now you're getting into an environment, and you're also, your mind and your ears and your brain is hearing things that are things that you're usually naturally our bodies don't want to be able to absorb, and that will cause some challenges. Just think of it as food, right? If you're eating food that's organic, like fruits, vegetables, you're having your healthy fats, your proteins, that's going to look very different in how your body is going to function and how your body is going to perform in the long term or in the short term, versus if you're eating outside fast food all the time, right? Fried food, oily food, greasy food, not knowing what the ingredients are that goes into this food. It actually affects your health, right? You either develop high blood pressure, you either develop, your cholesterol, your glucose goes high. So you have to be very mindful. That's how it is with us, with human beings. Our surrounding also dictates, what goes into our body when we have people around us. So being very mindful of that. Second is your physical activities. are you getting out of the house, right? Are you mobile? Even if you're not, if you're having a difficult time where you're not as mobile, try to do, sit while you're sitting, just move around your arms, do some activities that is catered to you based on your limitations. And that's something that you can, talk to with your doctor, with your physical, a therapist with. So always trying to be mindful that it's important to be active. Get up from the chair, go out for a walk in the morning. If you are able to play sports, go ahead and do that. Go for a swim, go for a walk at the beach. So these are very important to the body. And reason why it's also important to the body is because you're not just physically making a movement. What it does is that it allows the blood flow in your body to to go to the body and to the brain, right? So you're also doing, your body is doing work internally, which in return, when there's more blood flow, what happens is that there's a chemical in our brain which is called dopamine. It's usually released. It's a natural, we call it, it's a natural happy drug that we call that gets released and makes an individual feel good, right? And we want that for you. And that's all internal. Remember, it's not external, it's internal. So these are things that you can do to avoid getting into, having symptoms of depression or anxiety. Third is resilience. Now, resilience is basically how do you bounce back, right, out of, having certain symptoms, right? And I'll give you an example. There might be folks here, and I don't know if you have had these experiences or not. But for instance, I used to work at a geriatric where a lot of the folks that we worked with were stroke survivors. Were patients who had heart attacks. Patients who were unable to use get up and do day-to-day things anymore because now they're like bed bounded or they are chair bounded, and that changes the whole perspective of how you live life, right? Because that what happens is that at those times, if let's say if somebody who had a stroke, well, guess what? There's going to be times where you might be bed bounded for a while, right? Till you relearn those physical abilities, right, to get back into your day-to-day routine. If not, to a certain degree, you lose some of your sensories, right, and your mobility, and that can be very hard. And that is hard on individuals because that stops you from doing what you used to love doing, right? And that can be very challenging and difficult, and that can affect you psychologically, which in return can really put you in a state of depression in the long term. And I'll give you an example. I remember myself when I was in high school, I used to be an athlete, and I used to do cross country, and I used to wrestle. And I remember during that time, I had to go for a physical every year. I had to do a physical. Then one of the years I went to do a physical, and while they were doing the EKG and they were trying to do a physical body exam, they realized that my heart was actually not pumping enough blood, and they realized that my heart rate was somewhere around 40. It was beating 40 times a minute. So they were saying, wait, it's kind of skipping a beat. So luckily, for instance, I went to, to see a specialist, a cardiologist. And while we went and we did more checks, then we came to realize that I had a complete AV block, which means that the topper part of the heart, the chamber, when it sends a signal through its ventricles to the bottom to pump more blood, it was fully shut. It was fully blocked. Luckily, I was still okay. I didn't get a heart attack or a stroke, but over time, I realized while I was playing sports is that I would feel, my breathing getting heavy. I would feel my pulse get loud. I would get white flashlights in my eyes because I was getting lack of blood into the brain. And I remember at that point, it was, they recommended that I get into surgery and I get a pacemaker. So I ended up doing that. And even though it was a blessing that I got a pacemaker, I was very happy because now I was able to live life in a very quality manner. Life was much better for me because I enjoyed every breath that I took. Even my mobility was better. I was able to, overall, I just felt a lot better, like genuinely speaking, very well. But with that came restrictions. I wanted to be a pilot, and I couldn't be a pilot anymore because I couldn't pass the exam. So anytime I tried to apply for for the exam, one of it was a medical examination, and it stopped me from it. Knowing that I wasn't able to do activities again, knowing that I wasn't able to do what I wanted to do, right, at a young age, put me in a very bad state psychologically, right? And luckily, over time, understanding to accept, that hey, this is what, by the will of Allah, this is what has been prescribed for me. And then once I came to accept that loss and kind of accept that, what, I have to be resilient and I have to find a way to keep moving. And over time, it actually helped me where I was able to, change professions and then do what I'm doing now is being a mental health professional and coming out and speaking to everybody, and being able to share either my story or be able to psychoeducate my community. And that gave me strength, morale, and the resilience to bounce back, right? Similarly, same thing goes to everyone, so all of you that are here, figuring out what is it, what's going on with you, and trying to bounce back from that, from those challenging place where you're at in life can also be a good thing. And a lot of that has to do with acceptance, right? You have to accept, what's has come upon us, and the fact that we're no longer able to, do a certain activity or maybe able to eat a certain thing, right? Because now we're put on, the doctors are telling us, hey, you're restricted from eating X, Y, and Z. Or it becomes challenging, it becomes difficult. But once you come to terms of accepting that that it's okay, and that we can still live a life that's more fruitful, that can be more enjoyable for you, you would have to do it yourself, right? It's more of an internal battle, but it gets better. Fourth is, this is where it ties to resilience, is strong sense of self, having that strong sense of identity and self, like of knowing what is it that you want to do and how you want to do it. With that, having a good positive surrounding, environment or people that is with you, folks that are around you in a positive environment can also make that change a lot smoother for you, and it makes it a lot easier for you to be able to take those steps to be able to do what you want to do, because they create that positive environment for you, right? It's usually the environment that allows you to want to do more, or want you to keep coming to these programs, right? Like, for instance, everybody that's here, have to really think about it. Why do you keep coming in to, why are you called the Olivers? Why do you keep coming in? Because there's something that is provided to every single one of you that allows you to come back to this beautiful environment, because it allows you to build, it allows you to learn, it allows you to share and express and be part of a community, right? And it gives you a sense of purpose, and that's what it is. And then fifth is developing coping skills, and that can be going out. How do you? It's like doing swimming. Journaling is another good thing. Gardening, going out to the park with your grandkids. Just having small little activities that you can do, and making sure that you're constantly, applying that to your day-to-day will really be beneficial to you in the long term. Next, please.
So we're going to be going over a case scenario. This is just an example of a situation, and you can kind of apply the knowledge that you've learned so far throughout this presentation. I'm going to go over the questions first. So the first question is, what are Angela's risk factors? So like we mentioned before, risk factors are things that make a person more prone to developing anxiety or depression. Next is, what are Angela's protective factors? So kind of like what Wali went over, things that are kind of serve as like a additional layer of support from developing symptoms of anxiety and depression. And then what can Angela do to strengthen these protective factors? So this is kind of to have you all think a little bit deeper. How do we build off of what she already has? So I'm going to go ahead and read the vignette. Angela is a 70-year-old woman living in a nursing home. Angela recently moved into the nursing home after her husband, Phil, passed away. She seems to be experiencing continuous worry, fear, and sadness over her future and living life without her partner. Angela reports having difficulty falling asleep at night and has lost her appetite. She also finds it very difficult to enjoy doing activities that she used to find pleasurable. She is mourning the loss of her late husband while also trying to navigate her new life in the nursing home. Angela has family in the area that visit her several times a week. When she sees her family, she feels a lot better. She also enjoys crocheting with the other senior citizens in the nursing home. And Angela is a very social person and finds herself more entertained when around other people. So the first question is, what are Angela's risk factors? Does anyone want to answer that? All right, I will go ahead and answer it. So her risk factors would be her husband passing away, her change in living status, so she lives in a nursing home now, having trouble falling asleep at night, and losing her appetite. So those are all risk factors that make her prone to developing anxiety and depression. And then her protective factors. So does anyone want to answer this one?
Yeah, she's enjoying
social.
activities at the
Social,
center,
yes.
and she enjoys visits with her family,
Yes.
and she's enjoying the crocheting. So that's keeping her like, she feels like, she's doing something fun. So those are her factors. What are you calling them? The saving factors.
Yes, thank you so much. That's actually a very good answer. Those are all great examples. And then, does anyone want to answer what Angela can do to strengthen the protective factors?
To protect them. So you could keep going, keep doing it,
Yeah,
Keep doing, continue doing it,
great.
Maybe she can find new groups at the center, new groups or new activities at the center that would bond her in social activities, games, and that sort of thing, and other, let's say knitting or embroidery or things like that, where she could be with a group, and also keeping her mind busy.
Yes, thank you so much. That's so
Yeah, I think she should come out, I think she's not doing much activity. I mean, she should go out, maybe do a little bit of gardening or take a walk in a park, or if they have a garden there or a backyard. Yeah, she should come out, be in the sun, be in the open, with nature, connect herself with nature.
Yes, thank you.
And also, I don't know, in my turn, she should pray to God. That is one very healing, a source of healing,
Yes.
Prayer
Thank you.
is very important. Prayer gives you peace of mind.
And she can also do some, if they have a gym, or if she can just go for walks like Ismat said, and do some physical activity. Maybe, she can, if she's able to, and some of her peers, maybe they can start going for a walk or something.
They can join her and they can go in together. And
I
she's
think
lucky
she
she
just
has
needs to
family
meet
who
both of
visit.
you guys.
What did Xander say? I missed it.
She should meet both of you guys.
No,
She
no,
should
we
join
learned
Olive. I
it
think
from
she should
her,
join
what
Olive
they
on-
said. I learned it from them, like what they said. So, and for me, even though I'm not living in a senior home, we have an empty nest. But prayers, reading Quran and my Tuesday class at the masjid and Fridays, that really helps me a lot.
Thank you all so much. Those were all really great answers. And you all are right as well. Religion is a big protective factor as well. And that could be another way that she could strengthen it as well. So thank you all. Wali, if you want to go ahead.
Yes. So I'm using this headpiece, so I keep forgetting it. It mutes off when I put it on. So yeah, great discussion. Thank you for sharing. Beautifully shared, and I love how you guys said that meet join Olive, join the Olivers. I think that's the perfect way to go about it. It's the perfect way to go about it.
It has healed many of us, at
Absolutely.
least, yes, it has.
Absolutely, absolutely. Next, we're going to take a look at the management of anxiety and depression and what that looks like. It's broken down to 3 different categories, and it's some of the stuff we already talked about. And then A is, developing a routine, as we said earlier today, and as some of you just shared, right? Developing a steady routine can really help alleviate symptoms of anxiety and depression. And what does that look like, right? Beautifully said earlier on, getting outside of the house. And it's very important to, having a change of scenery will really affect your mood, right? And it really does. There's science behind that, there's research behind that. You want to get out of the house, even if, there's times where, where research also indicates, even a lot of folks, they go to their backyard, to their garden or in front patio, they go barefooted, right? And, they allow the body to their feet to touch the ground, they absorb the sun to get that vitamin D in them. That really helps. That really allows them to to develop it allows you to alleviate any signs or any symptoms of having depression or anxiety, because it changes the environment for you. Going out to the beach, right? Going to a swim class, going to doing yoga, right? I know Olivers are big on doing yoga, and that really helps. Going out for a walk, making sure that, and it's not just physical activities, but also things such as, chess, playing card games, playing board games. One of my favorite is, and I used to play this a lot with my elders years ago, was dominoes, playing dominoes. These are fun things to do and activities to partake in, doing artwork, getting a piece of paper and sketching and drawing, just making sure you're developing a routine that which you can follow, something that is within your own limitation, something in things where you have access to material, and you're able to get a hold of, where you can draw, or if you're going to the gym, you have materials or accessibility in order to get to that location. Just making sure that if you can create that for yourself, that'll be really good for you. Most of the times, people and folks, we have everything in our mind. So the night before, we pre-plan how the day is going to look for us. When I wake up, I'm going to go out for a walk. I'm going to make me a cup of coffee in the kitchen. Depending on what kind of coffee it's going to be, I'm going to call a friend or a family member to talk to them. I'm going to, have chores to do around the house. Like, creating a checklist is going to be very helpful. Getting a notebook or having your phone with you and just creating a checklist either the day before, a couple of days prior, or the week before will really help you. So allowing yourself to have that routine, it's going to go very well in the long term, because you're constantly mentally training the mind, and you're telling yourself that, hey, there's things to do, and you want to keep yourself occupied, right? And while you keep yourself occupied, guess what happens? And then when you put it in practice, you have to now get physical. You have to get up. You got to use mobility, and those things go really well they go well hand to hand, right? And you want to be able to do that for yourself. Second is social support. As we said earlier on, surrounding yourselves or ourselves with family, friends, and community that can be very beneficial. Just making sure that you're spending quality time with good friends, family members, and the community that you're in. Understanding, well, what am I doing, right? If I'm going to an environment, or if I have a support system, are they, is it of benefit or is it not, right? Is it causing more harm, or is it doing me more good? So being very mindful of that. And then lastly, when things, when you try different things and they don't work out, right? Or if you're somebody who's not doing these things, or are unaware of how to go about doing these things, how to set a good routine, if you're telling yourself, what, I have a good routine, I think I've got a good social support, but there's still something missing. I'm still having crying spells, and I'm feeling low. I feel like I have low energy. Well, then we suggest it's okay to reach out to a professional. This is where we come on, right? We as professionals, as therapists, to sit with you on a one-on-one basis and talk about, well, what's going on. Let's kind of dive in deep. And what we do is we do a thorough assessment of like understanding, the things about to kind of do a biopsychosocial to have a better understanding of, or have a better perspective of what's going on in your day-to-day life. And based on those conversations that are confidential, right, between you and the professional, it's usually not shared with anybody else. Then we get a better sense of knowing, well, you know what, hey, the professional can better help you understand or help you see things where you might not be aware of, right? You might be doing something, or the way you're processing or understanding information that you receive might be very different, right? You might think this is normal and it's okay to do, but and later on, when the professional pinpoints it out to you, and it's like, hey, this might not be very healthy. This might be, what you're doing might be affecting you, this way. For instance, I'll give you an example. Currently, we're working with a lot of Afghan refugees. So majority of the Afghan refugees who've come to the States, they are enduring or they're going through trauma, right? But when we talk about, seeking support or mental health professional support, they deny it and they say, you know what, everything's okay with us. We came to this country. Now we don't need any of that. We're away from war. We're away from violence, or, we're much calmer now. But guess what? When you go through trauma, it affects your nervous system, both psychologically, physiologically, you start having somatic symptoms. But people don't understand those, having trauma, it doesn't just leave the body, right? It's actually there. And it stays there, and it starts to take its course slowly as time goes on. And you might not be aware of it because you're dealing with other things in a different country. But when you come to, like, for instance, America, or if you're in a different setting, the circumstances might be different. You might think, well, you know what, I'm okay, but in reality, you're probably not. You're probably either not sleeping well, you're probably not eating well, you're probably having a hard time adjusting to the new society. And these are things that we hear later on, like, hey, it's a little difficult. I don't know why I'm having, nightmares, or I hear things such as, there's a person that reminds me of, somebody back, in Afghanistan that didn't treat me well, or didn't, say nice things to me. And whenever I see this individual, even though I don't know them, but because of their demeanor, but maybe the voice, or the tone of voice that they use is affecting me really badly or really negatively, right? Because again, trauma takes its course very differently. So we have to be very mindful. There's times where we don't know, right? Is it smell? Is it through means of smells? When let's say, for instance, if you're smelling something and you start getting a really bad headache, and after that you notice that your mood changes, right? And it starts to affect your day, and you're not happy, right? You're feeling down now, you're agitated, or you're irritated. That's because something has happened in the past, or there's something that smell is causing, which is, whenever you smell it, the brain is trained that smell at some point of time in the past in your life has caused some form of, you had endured something which reminds you of that smell, which was not positive, right? And I'll give you an example. I have a 17-year-old young man who recently came through the borders from South America, Mexico to America. He tells me that there's a certain smell that he smells no matter where he's at. Even though this kiddo is good, he's in school, he's working, he's rebuilding a life for himself. But he said there's a certain scent, a smell. Whenever he smells it, he just couldn't describe it. But he said, whenever I smell it, my day just goes bad. I start having headaches. Even when I'm with my friends, I don't want to, I don't enjoy my surrounding anymore. I just don't want to do anything, and I just get angry. And I asked him, I'm like, well, what does that smell, remind you of? And he said, I can't really describe it, but I can tell you that that's the same smell when he was imprisoned in Mexico, where he was held for 2 weeks. He wasn't given much food. He wasn't given water, and he was very close to, he got malnutrition. He was in a very bad state where he almost died. He almost died. But that smell reminds him, it takes him back, right? It takes that body back to where, when at the time when he was in prison, it takes you back into that situation. And obviously it's at a time where you feel very low in life, and it's very hard and it's very challenging. And that happens, right? But again, this is just one example. When you listen to things, right? When you see things, when you physically feel or endure things, that all causes challenges and somatic symptoms in the body. So we always say, please reach out to a mental health professional or that can help navigate and work with you on that terms. Next, please. The next thing we're going to do is it's kind of fun. It's grounding techniques. There's 3 things that we wanted to share with you. If you can, I would say, anybody that has, experiencing symptoms of especially anxiety, right? When you feel like, well, my heart is beating very quick, fast. I don't know what's happening. My mind is kind of scattered. You probably feel like something is wrong. You have no control over, your environment or yourself. What we do is we ask individuals to do the following to help ground you, right? And it helps you calm down. And what you can do is, you can do the box method. If you look at the graph, it kind of breaks it down into four things while you do the activities. So the 4 section of breathwork activity involves breathing in, holding, and breathing out, and then pausing again. So basically, if you look at breathing in, you want to breathe in. As you breathe in, you say, while you're breathing with your fingers, you can always count 1, 2, 3, 4, hold, and then another hold for 4 seconds. You say 1, 2, 3, 4, and then you want to release. While you're releasing, make sure you're counting to 4. 1, 2, 3, 4. Not allowed, but internally, or you can have a clock that's set to 4 seconds. And then lastly, you want to pause again for 4 seconds. 1, 2, 3, 4. Now, I welcome you all. I'm going to do it once or twice. If you guys want to join me while I do this, please feel free to do this. So I'm going to go ahead and breathe for 4 seconds. So now I'm going to hold for 4 seconds. Now I'm going to release for 4 seconds. Now I'm going to pause for 4 seconds. And then you repeat that again. And you want to be able to do that for at least 1 or 2 minutes or more if needed. But that's one way to, ground yourself when you feel like, hey, something is wrong, or I don't feel good, or my body doesn't feel good. I'm having stomach pain or aches. I'm feeling like, my heart's racing, or my mind is not, I can't have a collective mind at the moment, or something that I want to do at the moment. Let's say you're writing something down, or you're about to cook, but your mind is preoccupied with something else because you're not in the moment. Just utilize this box breathing, and that will help ground you. Maimoona, you want to hit the second one, please?
So our next method is the 5, 4, 3, 2, 1 method. This is another grounding technique that brings us back to the present moment, because when symptoms of anxiety or depression do arise, we kind of forget where we are, what we're doing, because it's worry about the future. And so this kind of brings us back to the present and really helps ground us. And so I'm going to go over the 5, 4, 3, 2, 1. So 5 things that you can see. You list out 5 things you can see, 4 things you can touch, 3 things that you can hear, 2 things that you can smell, and 1 thing you can taste. So this is just to bring us back to our environment. So I will go ahead and go through this. 5 things that I can see would be my laptop, my windowsill, my mug, my notebook, and my pencil holder. 4 things that I can touch would be my desk, my laptop, my sweater, my hair. 3 things that I can hear: the cars outside, my voice, and the humming of my heater. And then 2 things I can smell, the trees and the flowers outside. And then 1 thing I can taste, my tea. So this is kind of just, getting our senses to work and realize where we are, and bring us back to the present moment. And then Wali, do you want to do anchoring?
Absolutely. In the anchoring statement, it's things such as, I am here at my desk, sitting in this Zoom meeting with 30 participants. Now, if you look at it, the wording, you're reminding yourself that, hey, I'm the one that's here, and I'm here at my desk currently, because you're kind of, what you're doing is you're reminding your mind in yourself, and you're sharing it out loud that I am the one sitting here, and I'm going to be on Zoom, with 30 participants, or with this, and I'm going to be speaking to this individual. And the reason why we say it's important to do this, or having anchoring statement, is we want to encourage that you always use I statements. I statements are very powerful. I statements allows an individual to be able to empower themselves to tell themselves that, hey, I can do this. I want to go cook. I want to go out with my friend and go for a walk. I want to do this, right? Because what you're doing is you're willfully, you're willing to get out, and you're the one in charge of doing things. What you want to avoid is say, I have to do this, right? And when you say I have to do this, like, even look at the tone of the way you approach things, right? What happens is that approach or that understanding will also alter the mind to think very differently. And when you say I have to, now usually that is, when you say I have to, that's basically you're putting yourself in a situation where you're conditioning yourself by telling yourself that, well, I have no choice in this, and I have to do this, regardless if it's fun or not, if it's something that you want to do, or if or things that you don't want to do. So we always say, try to use I statements. It's more powerful. It has a bigger impact, and it has a beneficial impact for you in the long term, because you're making those choices. And even if somebody comes and says, hey, can you help me, move a couple of these items, you don't, in your mind right away say, yes, I am going to help you, because you want to be the one to do it, right? So always use I statements if you can. Next slide, please.
So for further care and management, we decided to put together a little list of tips for managing anxiety and depression. Our first one would be seeing a mental health professional for short-term management and coping skills. So seeing a mental health professional would be beneficial because they would look at your symptoms and how to make coping skills that actually match you in your life and things that you actually enjoy doing. And it just like caters a treatment plan for you. Next, we have implementing grounding exercises and mindfulness in your daily routine. So the three that we went over are just like a few. There are so many more out there, and we could only go over three in our limited time. But just having grounding exercises is a very useful tool when managing anxiety and depression. And then establishing a close support system to increase your level of belongingness. This is very important because, like we mentioned, community is a big healing factor and a protective factor when managing anxiety and depression. And, being around your community does really take your mind off of things and allow you to feel a sense of belongingness.
And then lastly, we're going to jump into supporting your loved ones through anxiety and depression, because it's not going to be just us, right? It's not going to be just you as an individual constantly feeling, having symptoms of anxiety or depression. You're going to have loved ones come to you, that are going to approach you and tell you that, hey, or you're going to be able to witness, or you're able to see that, somebody's having crying spells, or somebody you see that there's a change in their mood, or there's a change in the way they they're engaging with you. So it's very important to note that as a person who's observing, or a person who actually hears what is being said by someone is feeling symptoms of anxiety or depression, is to provide a listening space for them, right? Provide that safe space for them. It is critical to listen to them from a non-judgmental stance. We just have to remind ourselves that we're not there to give solutions, or we're not there to fix someone else's problems, right? We're there to hear and listen to what is it that they have to say. Maybe there's a lot that they're going through, which they haven't had the opportunity to share with others. So for that, just hear them out, just listen to what they have to say. And then secondly, again, if they ask, what can be done, then you can share your own experience if it's worked with you. You're more than welcome to do that. But you also have to remember that everybody's challenges and life situation is different. Maybe something that you have done in the past that helped you at that specific time or moment might not apply to the person you're helping now, right? Maybe that specific intervention or that specific piece of advice might not support that. So we always say, just connect them to a professional. That's all. Connect them to a professional because, what you've done your job. You were there, you listened to them, you heard them. And now you just want to be able to connect them to somebody who's more of a professional, who's more trained in this field, and just letting them know that, hey, I'm here every step of the way with you. I can make a call, while you're here, we can make the call together, whatever you need, right? You can make a call, or if you like me, I can make the call with you. Just be there with them as a form of a support and allow them to take that step forward. And then lastly, is to check in with your loved ones regularly. And this is something that we put in is the reason why you put this in is that we've noticed that also, people around us, either our kids, grandkids, community members, people that you're around, your friends, it's always important to ask, hey, how are you doing today? And not just, oh, I'm doing good. No. How are you doing today? Like, honestly, like, are you, how are you feeling? Really feeling? Share with me. Are you feeling good? Are you okay? I'm here to listen to you. I'm here to provide support. So I know we always have conversations, but I want, just tell me, how are you doing deep inside? What's going on, right? If they share, great. If they don't, that's it. You did your job and you did your work.
All right, that is all. Does anyone have any questions for us?
I would like to read out a question that was sent as a message. So one of our Olivers is experiencing a situation with a friend who is ill. And because of that illness, they're very quiet. They've been very silent. They don't answer their phone call when they're trying to check in with their friend. How can our Oliver help this person? They don't live close. Not answering the question also affects the Oliver herself too, because it makes her feel helpless and makes her feel down. Because she wants to be there for this friend, but the friend is not motivated or accepting of that help or that phone call or check-in.
Yeah, thank you. Thank you for that question. I think there's a twofold question to this, right? One, as a friend or as an Oliver, you're doing the best that you can for this individual, right? And you always, and that's the idea is, you try to do the best that you can for them. That's one piece of it, right? How far you're able to provide service or support to them. That also goes with, what is the other person's response? In being, are they engaging you? Are they able to, do they want to come out? Do they want to be able to support you? Or, do they want to partake in any programs or not? That's a totally different thing. But I would say, you're doing your part. You're trying to reach out. You're trying to provide that space for them, that accessibility, that availability. Try not to overly put yourself in a situation where you have to fix what that might be out of your hand. Because there's times, even for us as professionals, sometimes certain things are out of our hands too, right? We do the best that we can, then we have to allow that space or time for that individual as well. Because maybe at that specific time or moment, that individual probably, might need support in a different domain, or they have something else going on. So it's very hard for them to, engage with you at this moment. Secondly, I would say, I don't know if does this person have do they live with a family member or anybody or friends that are around? Because I know trying to navigate around that would be very beneficial as well in trying to reach out to this individual through a family member or through a friend. Is that an option there or no?
They live alone.
They live alone. Okay. And so if they live alone, so basically they're not partaking in any events, but they're having some form of communication with someone, right? Or no?
Possibly. But do you stop trying? Like if you're getting silence when you're trying to reach out to a friend, like, sometimes you want to help people, but some people may not show the need that they need the help or show that understanding. I mean, that happens a lot when people are depressed or isolated. They really isolate themselves even more from society and from social gatherings. So in those kind of scenarios, I mean, you obviously can't force them to communicate or whatnot. So I think that's a big challenge that we see, right? There's a lot of people out there who are experiencing this issue. It might be even a spouse who just is not as connected to society or to socialize and whatnot. And it could be different forms of depression, but just a thought, like, how do you help somebody who doesn't want that help or doesn't show the need?
Yeah, no, that's a good question on that. And to say for that, it goes back to, like you said, the person probably doesn't seem to want the help. Maybe they don't need the help, right? Maybe it's because of inconveniency if they live far away, where they're like, you know what, it just doesn't make sense for me to partake or to be able to partake in a group scenario or go and join a certain group and go to events. It might be of inconvenience to them. Again, they might not need it. Second, it might be if we always say if individual expresses symptoms or shows, or you see that, okay, there's some form of self-neglect or there's an abuse taking its course, then at those scenarios you would contact APS for reporting. That way, if someone is sent out to do a thorough assessment to see, is this person safe enough to live by themselves? That's an option. Just to be sure, that's an option for a person or for someone to do. So that way okay, this person, are they being taken care of, or are they taking care of themselves, or are they not take care of themselves? That's one component. Secondly, if you notice that this individual doesn't show any signs of self-harm, but tries to are socially isolating themselves from different groups of individuals, it's going to be very hard to really navigate that, because there's no sense of self-harm, or they're not being abused, but they're willfully choosing not to partake in a social gathering, meaning that if they're mentally able to, they're cognizant, if they're able to make sound decisions, then at that point there's nothing that even we can do, because as long as they can make sound decisions, they are able to take care of themselves, but they don't want to engage with certain groups or a specific group, or hang out with a specific friend again. It just becomes difficult to really keep pursuing, trying to keep pursuing to that, because that's just that happens at times too. That happens.
So much, Wali and Maimoona, for your insights today. I think the session is important to have because we need to open the conversation of mental health. Unfortunately, there's a lot of stigma when it comes to mental health in our communities. So, just like you seek prescription from a doctor for some ailment, right? You might get doses for a few days, few weeks. Just like that, getting a mental health expert for a few sessions is not a bad idea. There is organizations like Qazizada and several organizations that provide free mental health therapy, or they have a sliding scale where, based on your income or your insurance, they can make it work so that it's affordable. So don't hesitate. If anything, we can provide you resources or connect you to the right organizations. We don't have to become therapists, but we can connect them to resources. A lot of times people will ask me, why is Olive good for me? And, why is this needed? And they won't realize, but, just getting out of your home, connecting with others, it's good for not only yourself, but it helps somebody else. Just like Brother Wali said, asking others in the classroom, how are you? How are you doing? How's everything with you? Just checking in. You don't know what their story is. You don't know what they're going through. They may not be sharing it openly, but that one question might make their day and really elevate their spirits in a positive way. So make a difference with every interaction and have a good rest of the day. They have shared their information in the chat box, and I will try to copy and paste that in the WhatsApp group as well for you guys to have.
Okay.
Again, thank you to both of you, and have a good
Thank
rest
you.
of the day, everyone.
Yeah.
Olive Community Services is a 501c3 nonprofit organization based in Southern California that provides culturally appropriate services to seniors, their family, and the community. Through its physical and virtual interactive programs, Olive engages participants in a variety of ways that promotes health and well-being. To learn more about Olive Community Services, to get involved, or to make a donation, please visit www.olivecs.org or email info@olivecs.org. Be a change maker, and together, let's live, learn, and thrive.